Hello, my name is Lindsay Beal, and I am presenting my final presentation speech for this class. Here are my three presenters, or listeners, I guess. Alrighty. Hello, everybody. Thank you all for taking your time out of your busy day to listen to my speech. Today we're going to talk about heartworm disease and how terrible it is. And us as veterinary staff professionals should really make sure that we're kept up on the knowledge on this disease and make sure that we're sharing that information with our clients properly. There are lots of different types of topics that I could pick when talking about heartworm disease, but today I'm just going to focus on what heartworm disease is and how to prevent it. So basically what heartworm disease is, which I know y'all all know this, is characterized by worms in the heart that live in the heart, lungs, and arteries surrounding the heart and lungs. These worms can grow up to a foot long and live for an average of about 5 to 7 years in dogs and 2 to 3 years in cats. So yeah, just not something that I think anybody would want in their hearts. This disease affects both dogs, cats, and ferrets. But many other mammals in the world can carry it, which is what causes the spread to be so kind of wide and vast, because coyotes carry it, foxes carry it, and as we all know, they travel far with that infection in their blood. Mammals can get infected by, obviously y'all know this too, they're infected by mosquitoes that get infected by biting a infected host. So something that I learned in my research is that it's actually, because I've always explained it as the mosquito injects the dog with that larva. But I actually learned today that once the mosquito bites into the skin, it like secretes the saliva, and then once it flies off, the larva is actually in that saliva and it goes into the bite. And that's actually how they get infected. It's not like a little injection like you would think, because mosquitoes sting us with like a little needle, you know. So I thought that was kind of cool. And then something else that I found on the International Heartworm Disease web is that it's about 7 in 10 mosquitoes carry heartworm disease, which I thought was a lot. That's kind of really crazy. And heartworm disease is on the rise recently. I mean, I know y'all know that in our Athens shelter, every dog seems to be heartworm positive, and there's so many more heartworm positive dogs in Atlanta, which really sucks, which is why I decided to do this for my speech, because I do think it's important that we make sure that we're educating our clients on this. So in canines, they're what's called a natural host, which means that the adult and male worms survive, mate, and procreate, meaning the worms just sit there and increase. They don't have to be constantly stung by infected mosquitoes for worms to be produced. They're produced by just one sting. And cats, it's a little bit different. They're called, ectopic host, which means that the worms don't mature fully. So they are only immature worms that live there in the heart. They still do just as much as damage in the heart as they do in canines when they're in there for 5 to 7 years, like I said earlier. But in felines, because they don't grow to their full mature length, they don't live to their full mature time frame, which is, so it's only 2 to 3 years for felines. Since the worms are so large, a foot long, that's pretty big for a small animal, it causes the heart to overwork, which progressively diseases the heart, lungs, and vessels. And even after these patients get treated, they still have diminished quality of life and lasting disease on their heart and body from those worms. Fortunately, there are multiple treatment options out there for heartworm disease. In canines, we've got the injectable option, and then we have our slow kill methods, which there's multiple methods for that. But I always like to say it's expensive. It's a lot more expensive than just giving your dog their heartworm prevention every month. So that's always something important to remember. I like to throw out that it's expensive, guys. You don't want to drop $3,000 for your dog to not get heartworm prevention, or not to get to prevent or to kill all of the heartworms. And it's very risky to do it. Like, nobody wants to put their animal under risk like that. With cats, they're a little different. We know cats are, they can't take the amiticide treatment or ivermectin. So unfortunately, heartworm disease is 100% fatal in cats, but it is a little bit less common for cats to get them. But it actually is on the rise, right, with canine heartworm disease rising kind of in the U.S. Cats have up to about 3 immature worms living in their heart at a time, no more. These worms cause a lot of respiratory damage, and there's actually one specific respiratory disease called HERD, I believe, HERD, that damages their entire respiratory system, and that's ultimately what kills them. Unfortunately, they're not able to receive the treatment, but there are preventatives out there for them. We've got the HeartGuard Chew, and then we've got the topicals that they also can use to prevent them from getting heartworms. For canine prevention, we've got unlimited resources for that. For our clients that don't mind giving their dog a chew every month, they set an alarm on their phone and they see it and they give their dog a chew. That's wonderful, great. I can't do that. I have 50 alarms and every note up on my walls in my apartment, and I still can't remember to get the dog's heartworm prevention. So that's why I love ProHeart injection, because that is just one injection that they get either twice a year or once a year, and that protects them from heartworm prevention or from heartworm disease, which is wonderful. As veterinary professionals, we need to make sure that we're doing our part by educating our clients, and not only our clients, but our friends and families and even strangers. Like, you see a person at Southern Brewing Company with their dog, be like, hey, is he on heartworm prevention? Do you know about heartworm disease? Because there's so many clients come in here and we're like, well, heartworm prevention are you on? And they're like, what's that? And we're like, wow, you have this 6-year-old dog and you've never been educated on heartworm disease? Like, that falls on veterinary professionals, and not always just us as a team, because these people could be coming from different vets or rural areas that don't educate as much as we like to. So hopefully today I have given y'all a nice refresher on heartworm disease and how we can make sure we're doing our part in veterinary medicine. Thanks, y'all.